When you did the initial decompression, did the scoliosis resolve spontaneously?
It didn't. Dr. Benitez has shown this in the past that sometimes you see improvement in scoliosis, but it essentially stayed the same and maybe progress a bit over the course of years.
I have a question for Tyrone. Can you hear me? Is it
Yep.
working? I don't think it's on. It's on. I really appreciated your presentation. I'm doing a very similar program as you, more on the veterinary side, and we're doing a genetic study actually in dogs. And one of the problems we're running into is phenotyping our cases. And so I was just curious, is it just presence of CM, or are you doing kind of more detailed any morphometrics? Like, how are you phenotyping? And then for your your familial graphs that you're showing, are all of those family members imaged, or is this more, are they symptomatic, showing signs, or asymptomatic?
Yeah, good question. So basically, we asked all the participants in our study to send MRI imaging, and we go through the imaging, and we can classify what type of Chiari or there's Syringomyelia present, and then from there we could stratify patients based on, because not only do we get Chiari malformation 1, we have Chiari type 2, 1.50, all these different types, and we can stratify them and see which genes correlate with which phenotypes. And yeah, the genetic study in the dogs is really interesting. I read a paper that showed there were some GWAS studies in dogs too, so that's pretty interesting. Yeah, right now we're doing MRI findings. I just started in January, so we're pretty new at this. This is the way we did hydrocephalus. So, and then we'll stratify based on what we find in the initial study.
I just want to make a comment on that. I think that's a great point. I think it's going to be a challenge. That's always been the challenge for Chiari and genetics, is the fact that that is an arbitrary number, the 5 millimeters. And hydrocephalus is clear because you can see someone has hydrocephalus, and that's a very distinct entity. But that's going to be a challenge. I guess you're working with King Charles.
Yeah, and we're just struggling because we have such a diverse population of asymptomatic dogs, symptomatic dogs, and then those that have really severe scans and no signs,
Yep.
and those that have kind of mild scans with really bad signs, and so trying to phenotype and pull genetic information off
Yeah.
is kind of a nightmare.
Yeah.
So I was hoping that you had a better idea.
I'd love to talk to you after this. Actually, I'd love to talk to you about that after this. Yeah.
Can you just clarify that the unaffected are all scanned?
Not all of them so far. We're going to see how it looks with just the scan MRIs, and then after that, we'll probably require everyone to be scanned in the study, even the unaffected, to make sure that our pedigrees are, like you said, like you could be asymptomatic but also have a Chiari malformation easily. So.
Okay, you said that Chiari is a genetic disorder, but sitting in the support group, I think it was yesterday, some of the participants said they realized they had Chiari because of trauma. What is the connection between trauma and Chiari? Is it genetic? Is it that they carried the gene? Or is it that the anatomy of the brain was disturbed when they had trauma?
Yeah, that's a really good question too. So there are secondary causes of Chiari. The patient I showed with our whole exome sequencing, he had this disease called Dent's disease, and actually was on the monkey bars, fell down, and got an MRI, and that's how we identified the Chiari. He was 10 years old. In that case, I think he did have a genetic component, and it was just coincidental that there's trauma there. But I do think there probably are traumatic cases that could cause a secondary Chiari, but I wouldn't say that those would necessarily have to be genetic or have a genetic component.
And the other possibility in some is if they already have some tonsillar herniation, they have a trauma with blood spill, it settles down into the subarachnoid spaces, causes adhesions. That can trigger a progression slowly over time of the trauma. There's a third group which they didn't know they had Chiari, but somebody rear-ended them, or they got hit in the back of their head, or they delivered their child, if you will, that it tightened probably up just a little more, and then they're found to have the Chiari, but they probably had it before. That's another group.
But I think you bring up to a point that it's dynamic. The tonsillar herniation is not always there present. You see imaging of kids who are less than 5 years of age. They don't have a Chiari malformation. You image them later, and they do have a Chiari malformation. I have plenty of examples of that. So it is dynamic. You have people that they gain lots of weight. Their BMI goes up. There's some tonsil herniation that appears after that. And that's not from just even pseudotumor. They're asymptomatic from pseudotumor, and they still, obviously have maybe a little bit of increase in sugar pressure, but it's not enough to give them symptoms of pseudotumor that you then still see, what looks identical to a typical Chiari malformation you see when someone is younger.
No, I support that completely. I have the classic case I showed yesterday, over 11 years. She came at the age of 55, has found to have Chiari at the age of 55, rounded tonsils, not that too impressive. She continued to work. 11 years later, she couldn't go any further. She's 4 more millimeters herniated, but her brainstem is stretched. She's got a syrinx in the upper medulla, in the upper cord. And what's fascinating is that a year later on the scan, she regains her pre-morbid look to the brainstem. So I think dynamic, I think something activates Chiari is the way that I've always thought of it. It might be trauma, it might be repetitive pulsations, and then it finally gets tight enough that then you're just going to just jam it down. Dr. Kula.
Yes, statistics from the 1999 NORAD paper were that about 25% of the patients that made up the 364 odd patients in that study, about 25% of them had noted symptom onset following a head injury. And about 6% of childbearing age women, in retrospect, noted worsening following labor and delivery experiences.
Thanks. This is a question for the panel, but also for any of the neurosurgeons in the room, just regarding the presentation of the recurrent syringomyelia, which I just think is such an interesting topic. And I'm curious as to whether or not you feel like that Cine MRI scan that you showed really made a difference in your decision-making, first of all. Second of all, does anyone feel like the Cine makes a difference anymore? I feel like people come to me with Cines and ask for Cines, and I feel like I just found myself reflecting on the fact that I haven't made a clinical decision based on a Cine in my entire career. I feel like you need to, you're going to make the decision about re-exploration based on the symptoms and the syrinx, not whether or not this study shows you flow. I'm answering a question for you, I'm sorry. But I feel, but I want to know, does anyone else agree with me? I guess what I'm asking.
No, I actually agree. Before that, something had to be done for that patient, clearly. And the Cine flow can sometimes support what you already want to do. And so you see a patient, let's say a different patient who has what looks like not much tonsil herniation, a weird symptom complex, doesn't really consist with Chiari, and you think we're probably not going to operate. This thing will support what you already planned on doing. Same thing in the direction. I was hoping to find a blockage of flow. Aha, here's the answer. But even though there was a bit of flow there, I still went and operated. So
it's just not very sensitive compared to what you find at surgery. Yeah. The second comment I wanted to make was that my algorithm's a little bit different in terms of the shunting of the cord. I feel like that's a real last resort, and I prefer to actually do a fourth ventricular stent at re-exploration if I feel like I see so much scar in the subarachnoid space that there's a good chance in my mind that it's going to come back. You're there, putting a stent in the fourth ventricle and leaving it there really has never failed in my experience, and precludes you having to go into the spinal cord, which I think is a highly morbid procedure in terms of failure and revisions down the line. It becomes a mess. So that used to be done all the time. I know Dr. Menezes has mentioned that was the standard of care, and Boston Children's, they do that all the time still. So I feel like that's part of the armamentarium that people maybe forget about. It's a real effective way of taking care of recurrent syringomyelia. It's not in that algorithm of yours.
I completely agree. I was hoping to show that, look how traumatic, how devastating the surgery is, invading lots and lots of normal spinal cord just to put a catheter in there. So when I look at it, I think, oh my gosh, I would never want to do that. So it is a last resort.
And then back to the Cine. So initially when we started getting Cine technology, we would do it fairly routinely. Now it's fairly uncommon. If I give the same Cine study to 3 radiologists, I get 3 answers. I might use it on a borderline case just to help, but where I do occasionally use it is in revision that it looks open, and in a few then I've found loculations or blocks, but routinely I agree that it's rarely used.
I just would bring up so I don't know, there are a few neurosurgeons left in the audience, about the issue of restriction or not of young people with Chiari malformations and restricting them from contact sports. I usually tell patients that if there's a 25% incidence of Chiari patients having a head injury as a presenting issue with symptomatic Chiari, and if there's asymptomatic children, about 12 or 13% will go on to have symptomatic Chiaris. That if it was my kid, I would restrict them from contact sports. And a lot of the pediatric neurosurgeons seem to be very cavalier, even after ever doing posterior fossa decompression, say they don't restrict kids at all, they can go back into contact sports. There was a recent article, I don't know whether it was in our local newspaper in New York, but that they did polls of high school students, and there was an incidence of about 14% of high school students not participating in contact sports that were reporting just on intramural activities, an incidence of about 14% of concussions in high school from whatever this intramural sports or other activities. So there's a high incidence of head and neck trauma out there from various reasons. And I think if you know you have an asymptomatic or what looks like a Chiari, I would be a little more cautious. I would be a little cautious about, stuff like that. I don't know if anybody else has expresses an opinion.
Well, the only thing is that the initial 24%, which is very helpful to a lot of us to think about trauma. There are two subsequent smaller studies, and the first one that came out where they actually interviewed the patients, and specifically, instead of looking at the histories that maybe were in the chart, it dropped down to 3%, and then there's another that looked at it more detail, and they argued 1%. It's been a while since I looked at literature, but I know I've had to look at it previously because of the legal issues that were related to the trauma. So I was happened to be at the conference at Conquer Chiari where the moderator asked the group of surgeons in the audience, what do you restrict children from? And there were about 6 or 7 adult surgeons, and we said a lot of the common things, football, maybe high-speed roller coasters, we'll talk about that. And there were 3 pediatric neurosurgeons, and they got their turn. None of them would restrict. And at first, that really threw me off, just like you said, what about my kid? But then I realized that when I see people at 20 and 30, they were kids once, and a lot of them were very active. And it's very rare, probably not zero, for a kid to get hurt. And I know there are pediatric neurosurgeons that may have other information. So I can understand, and I don't see very many young kids, 14 as the max. It is hard to know what to restrict them from. What is their risk on an average daily basis? We all run a risk on an average daily basis. And let me just close by, what about post-op? Because that was brought up the other day and we didn't really complete that thought. I do restrict some of my patients post-op, but I tell them it's non-scientific, it's my own impression. And one of them is contact football if they're a high schooler. We'll see kids from Nebraska, and if you're the quarterback in a small town in Nebraska, you and your family are tops in that town, okay? And it's very depressing to restrict someone from football. I did have a lady, 2 months post-op, a wiry young woman, who broke her C1 because we have decompressed the arch of C1 posteriorly. And she cracked the anterior arch of C1. A university hospital, another state, managed her in a collar for 3 to 4 months. And how did she get that post-op? She got thrown 30 feet through the windshield and broke her. She survived. And she came to me. I reconstructed it with screws and just gave her a new arch mechanically back in that area and allowed her. So football to me, because of the nature of the ring of C1 and the load, and you know how it's an arch like that, it's natural to pop that. So I do restrict post-op patients from. Now, I will tell men and women in their mid-30s, 40s, 50s, I'm sorry, but I'm not going to let you play contact football. You get a little laugh usually, right? The other is a bias, and I tell them. So it is high-speed roller coasters, and I'm just biased on that. And that is that when I was on the AANS board, we had Six Flags contract with the board. They wanted an opinion because of the injuries in these new high-speed roller coasters. We're kind of looking at each other, well, what are they looking for us at? And one of the testimonies from the engineer was that the G-forces in those new roller coasters was higher than what we were putting our astronauts through. And I thought about it, and we all know about head injury. You're going this way, and then the roller coaster changes that way. Your brain is still going that way, and it's hitting, it can hit inside the skull, et cetera. So, but it's a bias. On the other hand, Six Flags was definitely concerned because they had incidents of subdurals, they had incidents of, especially in older people, they had incidents of neck injuries. It turned out that the thousands of people that that used those rides every summer, the risk was extremely low. But the Six Flags apparently came back and they, increased their padding and all their. So that's the other bias. The final thing, and maybe also a little bit tongue-in-cheek, I usually say, if skydiving is on your list, put it at the end of your list.
Just another comment. I have two daughters, and one had a concussion playing field hockey, the other had a broken nose from a lacrosse ball. So we talk about male sports, kind of like football, but it's known that women are much more susceptible to side-to-side collision injuries, and that's what you see in lacrosse and field hockey. And the protective gear in women's sports is, I don't know why they don't step up with helmets and that, but they are just as tough and as rough as the guys out there, sometimes even worse. So that's another issue, I think.
Interesting.
Up the
Ian, any thoughts from children?
young kids in the sports that they
Yeah.
want to participate in.
Yeah. I sort of echo what you've been saying. I make a distinction between pre-op and post-op. With the incidents that we have with, the number of kids that play contact sports and the ubiquitous incident in Chiari population, we would expect to see patients on any given Friday night, coming in with injuries with respect to the Chiaris, but we don't. So in that sense, I don't necessarily, what I tell people is, I don't think you're at any significantly increased risk versus the population. Post-operatively, I feel a little bit differently, particularly if you take the posterior ring of C1, just by reflecting the nuchal muscles off the back of the occiput and then putting them back, that alone affects stability. But then you also start taking bone and ligament, and there's no way you're not changing and decreasing the stability of the occipital cervical region by that. So even though we don't have data, just intuitively it would seem that people are at increased risk with respect to contact sports. In terms of, I was never I never had too much of a concern about roller coasters until when I was still practicing in Jacksonville. My partner had a patient that they did a Chiari on and did well post-operatively, and then a few months later came back with severe neck pain, had a fracture of the anterior arch at that point, responded to a fusion, but later we learned that the pain started after they made a trip down here to Orlando to one of the parks and rode a roller coaster. And then talking about the engineering and the biomechanics of the roller, it makes sense. So if that'll happen there, I think with axial loading and whatnot that we get in contact sports, I think it's too unsafe. But I also remind parents too that there's two levels of things. There's the medical level. I can tell you whether it's safe or not, but at the same time, they need to make a decision whether they want their child to participate or not, and what they're going to participate in. But also, it is very hard when you tell a parent whose child has been playing football and is really, deeply involved that they can't play anymore. Sometimes that's a very painful position to be in.
You know, and I was telling the risk to one lady. She was like 24-year-old, all the surgical risks. And she was listening attentively. And then I mentioned high-speed roller coasters, and her face fell. I mean, you could just, you know. So what I've gone on to tell them now, my population is generally a little older, is if they really want to ride it, give yourself a year. Then when you go to the park, ride the older rides. If you feel fine, consider the high speed. The next day, give me an email or give me a call. They haven't called me, they haven't given me an email, so I don't know.
I just mentioned another sport. We have a lot of girls in the New York area that are equestrians. And one of the first things they teach the gals when they start riding and jumping is how to roll off the front of the horse when they bolt at something. And I've had 2 or 3 young girls who we ended up restricting from riding, unfortunately, who had neck and head injuries and Chiari's and surgery just because of the risk. That's a very, you know, the story about Christopher Reeve, Superman, even got his neck broken in a horse fall. I have a nice picture of this gal who tumbled a horse jumping a 6-foot fence. And it's not only a vertical impact, but if they hit the ground rolling, it's a significant flexion or extension, hopefully not extension injury. But horseback riding is a lot more dangerous than maybe football.
Dr. Kula, I respectfully disagree with you, and I still horseback ride and do all the things that you tell me not to do, and I'm one of your patients. So, Dr. Oro, I actually respectfully agree with you in regards to the gut. Both my children and myself have been diagnosed with mast cell, which is autoimmune. My daughter is mood disorder. My son is anaphylaxis. I'm probably caught in the middle. I do notice a huge difference if we do not obey the, what is it called, Connor? Low histamine diet. Have you seen a large portion of your patients needing to go on that diet of low histamine if they have EDS?
I have not. I don't see, as maybe we've talked in the past, I don't see as much EDS. Certainly we see some. And thank you for opening up that question. It's certainly something that I'll keep an eye on. I think this Ehlers-Danlos and nutritional and autoimmune, and you know, I think we're moving along the way that hopefully we'll all get better answers, but I'm not aware enough about that to say. Thank you, though. Appreciate that, Brenda.
I was going to agree with the diet thing as well. Our 8-year-old son was recently diagnosed with ADHD and high-functioning autism. Oh. And we were told, try the gluten-free diet. And we thought, at this point, we'll try anything. And even before putting him on medication, we went from 2 to 3 meltdowns a week to maybe 2 to 3 a month, simply by a diet change. Yeah. And as well as the behavior issues for him, after 3 years of being pre-diabetic, all my numbers are normal now, just from the diet change. You know.
So I know we're winding up. Dr. Perlmutter has a book called Brain Maker. It's fairly tedious, but he has chapters on ADHD. I will say that some of the U.S. kids are traveling to Britain for fecal transplants, which automatically changes your microbiome. And at least, again, case reports, it's stabilizing some of these children. We'll have to keep an eye on that area. Excellent.
Yeah. Well, I wanted to say one thing regarding the diet. People need to, just a word of caution, that if you are going to embark on any one of these things, you have to take in mind that you're basically changing your body's metabolism over a period of time. Your body's using a different fuel and it has to adjust. And the first few weeks you're on these diets, it is miserable. But if you can get yourself through that, there's actually a world of good waiting for you at the end. So what we're going to do now is take like a very short 10-minute break of Coke and white bread.
I understand. I'm leaving. You can eat.
But I want doctors and patients, I want to encourage everyone to come back because we're going to do something here that's completely different. Instead of having a bunch of doctors talking to patients, we're going to have patients up here talking to doctors about their experience. And we like to think that we know what is best for patients in terms of a Chiari center and what a Chiari center should be. But what I was interested in hearing is what do patients think about what a Chiari center should be? So we'll be back here in 10 minutes and we'll see how that goes.